In this video, we are going to be discussing about post-viral arthritis. A very mild form of that is also just known as post-viral arthralgia. As the name suggests, it is pain in the joints after the attack of a viral infection. There are several types of viral infections that we suffer from, starting from the common flu to diseases like chikungunya, to diseases like hepatitis A, B, C and so on and so forth. Several of these viral infections are known to produce arthralgia or pain in the joints. Well, in many cases, viral infections are followed by mild forms of arthralgia, which are self-limiting and which get relieved automatically. Generally, they are said to automatically go into remission within 6 weeks. So most of the post-viral arthritis is self-limiting, only needs some supportive therapies in terms of some anti-inflammatory external applications or NSAIDs or some medicines that help to relieve the inflammation, and they automatically regress within about 6 weeks. However, there are some cases where the viral infection, especially those related to the alpha variety of this thing like chikungunya, are known to trigger a long-standing immunoresponse. They trigger the immune system in such a manner that the autoimmunity gets triggered. Hepatitis-related viral infections, also HIV-related viral infections are known to produce very intense type of autoimmune reactions which are then persistent. You can find a lot of rheumatoid arthritis also getting interlinked with certain varieties of viral arthritis. So the patient starts off as a post-viral arthritis patient, and thereafter the immune system also picks up other inflammatory reactions and tends to become a full-fledged inflammatory arthritis as well. While there is quite effective treatment for the self-limiting or the transient sort of an arthralgia which is post-viral, the chronic forms of viral arthritis need to be undergoing a serious sort of treatment. In conventional medicine, commonly the anti-rheumatic drugs or disease-modifying drugs like methotrexate and so on and so forth are required in some of those conditions, and even steroids are used when the condition is chronic. So there is a lot of desire to avoid taking these powerful medicines and being able to live a quality of life even while one has got severe post-viral arthritis. It is in this context that Ayurveda has a very good solution to offer. Starting from the mild arthralgia that starts following a viral infection, Ayurveda has something to offer in terms of some herbal medicines as well as external applications which can help the patient get relief from the immediate pain in the multiple joints that they suffer. Starting from that stage to the very chronic form of post-viral arthritis which also transits into more serious inflammatory arthritis, Ayurvedic treatment comprising of internal medicines as well as the therapies, as we call them as Panchakarma in Ayurveda. There are the Purva Karmas which comprise of certain external applications and steam application which sort of mobilizes the toxins and brings it into the digestive tract, and elimination of that through the Panchakarmas is known to be a very, very effective treatment in relieving and reversing the autoimmune reactions that are likely to damage the tissues. Though most post-viral arthritis cases do not go into erosion of the joint and complete destruction of the joints, there are a few patients who also develop serious complications post-viral. So it is in this context that Ayurveda especially is able to offer a very safe and effective treatment in reversing the autoimmune condition that results from a viral infection. At AVN Arogya, we offer Ayurvedic herbs and medicines at our outpatient clinics at different cities where in the initial stages of a mild viral infection leading to arthritis, we are able to control the condition and give the patient very good relief with just some herbal medicines as well as some external applications. In slightly more severe cases, we ask the patients to come for a few days of some therapies and they are fine. In cases where the disease is quite severe and it is quite debilitating, we have a procedure to admit the patients in our hospital in Madurai, and we are able to provide them the full range of Panchakarma treatment which is able to reduce the inflammatory markers as well as reverse the form of autoimmunity that is leading to the erosion and damage to the joint and reducing their quality of life. So we find that with this treatment, we are able to give the patients a very, very effective relief from their problems of pain, tenderness, swelling and redness and so on and so forth, as well as reducing all the inflammatory markers and improving their quality of life significantly, and prevent them from getting into degenerative skeletal muscular issues post-viral infection.
Go here to subscribe.